Well, good afternoon, everyone, and welcome back to our 2:30 update. I want to start today with an update on hospitalization rates and ventilator data. I want to remind everyone interested that all of this data is available, including regional breakdowns, on the Illinois Department of Public Health website at dph.illinois.gov, where it's updated daily. First, our hospitalization data. To remind you, this is a count of the number of COVID patients and assumed COVID patients in the hospital in any condition, whether mild or serious. So here's the time progression so that you can get a feel for the direction that things seem to be going. On April 6th, we had 3,680 patients. On April 10th, that number had risen to 4,020. On April 14th, that number had risen to 4,283. And as of April 19th, we had 4,599 Illinoisans in the hospital with COVID-19. That's a net increase of 316 from April 14th. For context, early modeling in mid-March showed that without social distancing, we would have exceeded our hospital capacity by more than 25,000 beds by April 6th. And to be clear, we are still seeing too many Illinoisans hospitalized with this virus. But because Illinoisans have come together by social distancing, learning at home, and staying at home, we've so far prevented our worst case scenarios. As you can imagine, when fewer people are contracting COVID-19, not only are there fewer hospitalizations, but also fewer ICU beds and fewer ventilators needed. I'll offer the same time series progression to you for our COVID-occupied ICU beds as I did for overall hospitalization rates. On April 6th, COVID patients occupied 43% of our 2,700 ICU beds. On April 10th, that number was 40% of 2,900 ICU beds. Remember, our institutions have worked to expand their bed capacity, which is why our overall bed number keeps increasing. On April 14th, COVID patients occupied 40% of the nearly 3,000 ICU beds. And that brings us to today. Of the 4,599 Illinoisans in the hospital with COVID-19 right now, 1,239 of them are in the ICU, occupying 40% of our now 3,100 beds. Another critical metric to watch is the number of Illinoisans with COVID-19 who are on ventilators. Of the 4,599 Illinoisans in the hospital now, 757 are on ventilators. That means 23% of our total ventilator inventory is currently in use by COVID-19 patients, continuing a downward trend from 25% on April 14th, 27% on April 10th, and 29% on April 6th. And I'll add that 23% of our total ventilator supply is about 10 percentage points lower than it would have been had Illinois not acquired about 1,000 ventilators since March 23rd, when we had about 2,200 ventilators statewide. Today, we're up to 3,200 ventilators. And again, had we not established mitigation measures, by now we would have needed thousands more ventilators beyond our existing capacity. So real progress has been made. And while we never know the exact impacts of the efforts all of you have made to protect your communities, all the projections indicate that you have saved thousands of lives. But as you've seen, our case numbers and our hospitalizations are still rising, even if that rise is slower now. Our curve is bending the right way. With the current mitigation strategies in place, we may not have reached our peak yet, but your actions are helping to keep that peak as low as possible. Also today, I want to discuss the terrible toll that COVID-19 has taken on our seniors, specifically at long-term care facilities and nursing homes, and to review some of the steps that my administration has taken to monitor and protect our long-term care facilities and nursing homes around the state, a priority since the earliest days of our state's COVID-19 response. On February 28th, in my first public update dedicated specifically to the coronavirus, I highlighted that the data from other countries clearly showed that COVID-19 tends to cause more serious illness in elderly populations. And on March 4th, 5 days before we initiated our disaster proclamation, we established guidelines to maximize preparations at our nursing homes, veterans homes, and long-term care facilities. Long before the first nursing home case appeared in Illinois, the state implemented strict measures around restricting visitors at the long-term care facilities that we operate, such as the veterans homes and DHS facilities. And we collaborated with industry associations to have the facilities that we regulate implement similar strict guidelines. We also instructed local county and city health departments on best practices and protocols for PPE usage, heightened hygiene practices, contact tracing, and family notification. And we have provided that training continuously since then. The week of our disaster proclamation, we began regular communication with all of our long-term care facilities, their governing organizations, and local health departments to provide educational instruction and answer questions. Between our educational webinars and regular calls, formal communication among these organizations and IDPH now takes place 4 days a week, with additional one-on-one discussions happening around the clock to troubleshoot issues as they may arise. On Saturday, March 14th, the first nursing home case was announced at a private facility in DuPage County. The Illinois Department of Public Health immediately sent a team of infectious disease experts to ensure proper protocols were being followed and ensure that communications procedures with residents, family members, and staff were implemented internally. When there's an outbreak at a long-term care facility, there's so much to do all at once, and the expertise doesn't always exist on the ground at these homes every day. So IDPH began to see that the most effective way to respond to an outbreak was to have a strike team of experts and advisors immediately make people and resources from the department available to double and triple check that training and guidelines were being followed. These experts have been deployed to a number of facilities since that time. The strike teams deployed have more recently evolved to include infectious disease control experts from the University of Illinois at Chicago and volunteers from Project Hope. IDPH also regularly consults with local county and city health departments who can then be deployed to facilities in their regions as well. The best funded and largest local public health departments, like the Chicago DPH, often deploy their own strike teams and ask IDPH to stand down. Beyond a lockdown, experts and guidance, another extremely important component of limiting infections at these facilities is PPE. A single confirmed case in a facility activates our guidance that all staff in the facility should wear formal PPE and all residents should wear masks. IEMA provides these supplies from our state inventory to local health departments to provide long-term care facilities with all necessary PPE beyond what they may stock and procure on their own. The state has now provided PPE to all 102 counties and made clear to local health departments that when it comes to distribution, the long-term care facilities are priority recipients alongside healthcare workers and first responders. Long-term care facilities that run low on PPE contact their local health department who provide it, and they in turn can get replenished by the state. As you know, we are continually scouring the global PPE supply chain and making acquisitions so that we can fulfill these requests as quickly as possible. I also want to talk about COVID-19 testing at long-term care facilities. First, it's important to note that once a nursing home has a confirmed case, we treat any additional symptomatic residents or staff as if they are a confirmed case. Formal testing has had nothing to do with whether a nursing home resident suspected to have COVID-19 can receive care for COVID-19. As for staff, long-term care facility workers are considered healthcare workers, which means they've long been able to access testing at our drive-through sites and other hospital locations that prioritized healthcare workers and first responders. As swabs and VTM availability increases in our state, we're now able to more aggressively deploy testing at our long-term facilities. We're implementing a two-pronged approach to this work. First, let's discuss facilities without known COVID-19 outbreaks. We're working to test all residents and all staff at those homes. We're prioritizing testing at long-term care facilities that are home to our populations where a COVID infection is more likely to lead to higher severity cases, especially among Black and brown communities. This testing at non-COVID facilities will allow us to identify early the presence of COVID-19 in a facility and isolate those cases before widespread transmission. With support from the Illinois National Guard and the Illinois Department of Transportation, our teams delivered tests to our first 2 homes over the weekend, and will do the same for an additional 10 facilities today, with more to come. Second, in facilities with known COVID-19 cases, we continue to operate under the assumption that a resident displaying symptoms of COVID-19 has COVID-19 and should be isolated accordingly and receive the appropriate care. One change, however, is that we've altered our protocol related to staff. Where in prior weeks we've advised that staff be given pre-shift wellness checks, including taking temperatures, we will now be ramping up testing on all staff who work at these facilities, all staff, allowing us to determine who is coming in and out of an infected home, possibly asymptomatic, and should instead be at home in isolation. This will be critical to our work to prevent further spread at these facilities. I briefly want to address concerns about long-term care facilities not adhering to proper COVID-19 response protocols. Thus far, facilities seem to have been responsive to IDPH guidance and compliant with IDPH teams on the ground. Just like our other healthcare workers, staff at these facilities are frontline workers, dedicating their days and nights to caring for seniors and doing all that they can to ensure a safe and healthy home for their residents. We, as a state, are deeply grateful for their service. That said, we will not hesitate to hold any bad actors at the management level accountable. These private facilities are home to some of our most vulnerable Illinoisans, and we expect owners and managers responsible for their care to take every action at their disposal to keep them safe. Finally, I want to make sure that our long-term care residents and their loved ones know that our statewide data about COVID-19 in nursing homes is available on the Illinois Department of Public Health website at dph.illinois.gov. Here you can find information about which nursing homes and other residential facilities around the state have a known presence of COVID-19, and we will continue to provide as much information as possible. So thank you, and now I'd like to turn it over to Dr. Ezike for today's medical update. Doctor.
Thank you, sir. Good afternoon. As the governor mentioned, there is a two-pronged approach to testing at long-term care facilities. We are ramping up testing at facilities without previously identified COVID-19 cases and ramping up testing for all staff at facilities with known cases. I thank Governor Pritzker for making the care of long-term care facilities a priority in the earliest part of our COVID-19 response. Again, the testing is just one of the elements of our plan, as the governor explained. Along with the testing, we also provide education and stakeholder engagement. Again, this is a partnership with the owners and staff at the nursing homes and the long-term care facilities. We're also working closely with the local health departments. The local health departments are the first public health entity that is to come in contact and assist at the long-term care facilities. IDPH also assists all of those entities by providing weekly webinars and also twice weekly calls. Monitoring and surveillance obviously is very important, and that's primary role of the state. We have the identification of the positive cases through our electronic lab reports that come to us, and also we have an outbreak reporting system. The third element is for local health departments and long-term care facilities to implement our infection control guidance. And as the governor mentioned, before ever we had a case, we worked to come up with a very intense set of guidances, including the pre-shift assessments, in signage, making sure that visitors were restricted. And so making sure that local health departments can request technical assistance from IDPH. We have that ongoing. And again, as mentioned, we have a team of infection control preventionists as well as infectious disease doctors that are able to be deployed. We also have enhanced engagement as another part of our plan. And this involves identifying when there are persistent problems. This could be dealt with more on-site monitoring and also more visits from our infectious disease doctors or our infection control specialists. And then finally, there's another arm to this, which is resident re-engagement. And that just has to deal with how we manage residents that are coming, who were at long-term care facilities that went to a hospital and then are trying to be returned to long-term care facilities. So this plan is to help overall our vulnerable populations, which we knew would be at highest risk, both because of the average age of individuals in the long-term care facilities, but as well because of the additional comorbidities that are in this population as well. I'd like to take a minute also to briefly explain the challenges with reporting data in real time for these facility outbreaks. To start, obviously, data is coming in to our systems hourly. So the facility is probably the best place to get the most up-to-date data, but we are pulling data from two different electronic reporting systems. One is the INED system, the National Electronic Disease Surveillance System, and the second is our outbreak reporting system. So obviously the local health departments and hospitals will put data into those electronic systems, and it's from there that we can aggregate the data and be able to share the data that's been put into our system. To help preserve the integrity of the data as much as possible when trying to report in real time, IDPH posts data as was reported from the day before, so there would be a lag. And because data is continually being updated, we are going to have the data up on our website, and we will update it once a week. And of course, the information that we pull out had to have been submitted. So if there's a lag from the local health department, we can only report obviously what we've been given. So I know it sounds like it's straightforward, but it's a little complex. We're dealing with multiple reporting systems and a lot of players who have to put the information in, but we at IDPH are doing all that we can to make sure that we share all the information that we can, while also being responsible and trying to protect individuals' privacy rights. We know that this is a different time, and some of the requests go further than what we have ever done in the past, and so we have to try to navigate that line and not veer too much and not also compromise the privacy of the individuals. And with that, I'll end today by reporting that over the last 24 hours, We're announcing 1,151 new cases, which brings our total for the state to 31,508. Unfortunately, there were 59 new fatalities, bringing our statewide total to 1,349. This continues to be a very difficult time. This is an unprecedented time, and we know that it will continue to take all of us doing what we're supposed to do, staying at home, wearing masks when we're outside, cleaning frequently touched surfaces. All of these steps will be needed to work together to end this pandemic while we wait for treatments and vaccines. Let's continue, please, to remain all in for Illinois. And with that, I will summarize comments for our Spanish-speaking population. Buenos tardes, y espero que la gente esté bien. Les mando mucho ánimo. Como el gobernador mencionó, hay un gran enfoque en los centros de atención de largo plazo. Agradezco al gobernador Pritzker por haciendo los centros de atención de largo plazo una prioridad durante la primera parte de nuestra respuesta a COVID-19. Estamos implementando un plan de 5 partes sobre prevención y también respuesta a COVID-19 para los centros de atención de largo plazo. La primera parte incluye pruebas, la educación y participación de grupos que trabajan con los centros de atención de largo plazo y los departamentos de salud locales. La segunda parte es la supervisión y la inspección, que incluye la identificación de casos positivos. El tercer elemento es que los departamentos de salud locales y los centros de atención a largo plazo implementen una guía de control de infecciones y asistencia técnica de IDPH. El cuarto es una intervención más profunda. Esto identifica problemas persistentes como la transmisión del virus y una visita de especialistas en enfermedades infecciosas. Finalmente, es el regreso de los residentes de centros de atención a largo plazo que han estado en el hospital. Este plan de 5 partes va a ayudar a proteger a nuestras poblaciones más vulnerables en centros de atención a largo plazo. También me gustaría tomarme un minuto para explicar muy brevemente los desafíos de informar datos de brotes en tiempo real. Los datos cambian cada hora. IDPH recibe datos que han sido agregados en 2 sistemas electrónicos. Vamos a poner nueva información una vez por semana. Les aseguro que es bastante complejo y estamos haciendo todo lo posible para ser transparentes y al mismo tiempo responsables a la privacidad de los pacientes. Terminó hoy informando que hay 1,151 casos nuevos, que nos lleva a 31,580 casos total. Desafortunadamente, necesito reportar 59 vidas perdidas y en total 1,349 muertas por el Estado. Este es un momento muy difícil y sin precedente, y sabemos que todos deben trabajar juntos para poner fin a esta pandemia. Todos siguen luchando. Vamos a salir de esto. Gracias. And with that, I will turn it over to Governor Pritzker for questions.
Getting my doctorate. Thank you.
Governor, some of these questions I've received from other reporters, including this first one from Sarah Schulte from WLS. How accurate are those nursing home numbers? Are residents who test positive and die at hospitals being counted as COVID cases, or are they nursing home deaths? Can you explain that part?
I'm going to ask Dr. Ezike.
I think we covered that. So the numbers that we have on our board in terms of cases are laboratory confirmed cases. And as the governor explained, there are situations in which there's a laboratory confirmed case in the nursing home, and if the suite mate or roommate, if you will, develops similar symptoms, they wouldn't necessarily need a test because it would be deemed by normal outbreak definition, that person has COVID as well. And so that would come under a COVID case, a presumed COVID case in our outbreak status, but there would never have been a laboratory confirmation. So does that answer your question?
All right, so the numbers that you've given on the nursing home and the number of deaths at nursing home, those, you believe all of those are accurate?
Yes, it's as accurate as the information that's put into it, right? So we're not in the nursing homes collecting the data. We are receiving the data from outside inputs, and so that's what we're putting out. So the data is as good as the data that went in.
And what about those nursing homes who are not letting patients return? We're hearing some hospitals are now become sort of a way station because the nursing homes are saying, no, thank you, we can't have you back even if you've recovered.
Yeah, so we are working through that. That has been an issue where we're working to identify the ways that nursing home residents, long-term care facility residents can get back to their home, if you will. And so trying to figure out the right time when it's safe for them to come back, when it's deemed that they're no longer infectious. We're working between the hospitals and the facilities to be able to identify that time and get people safely back to their permanent residence.
Thank you. Governor, were you on the call today with Vice President Pence?
I was.
How did that go, and what was the main focus of that call?
The main focus of that call was about testing. The White House is reiterating the White House COVID, what do they call the coronavirus task force is reiterating that states have testing capacity. And I've said this before, but testing capacity is a function of how many machines do you have, and if you ran them 24/7, what output could you get? The problem is there's a big difference between testing capacity and getting testing results. And what's the big difference? All those things in between that you need, like swabs and viral transport medium and RNA extractor reagent. And then you've got to run those machines with lab techs. And if you're going to run them 24/7, that's 3 shifts. So what they really have said is, hey, you've got plenty of machines out there, go to it. And what all of us governors said back, I did not get a chance to ask a question today, but the other governors who spoke, Republicans and Democrats, really said the same thing, which is we all need swabs, we all need VTM, we all need RNA extractor and reagent. And so, it was an interesting call because I think you can see how they're thinking about what their responsibility is. But the fact of the matter is that when they say there's lots of testing available, there's a far cry from testing capacity to actually getting testing results.
PPE, there was a shipment that did arrive that you had ordered. What about that? There is some criticism from the White House that they say you have not been truthful about the resources from the feds. And yet you spent $174 million on getting, and obviously not just that one shipment, but did you have to go that far and that expensive to get what you needed?
Yes, and the reason is because the White House has not delivered what it has said it would deliver. Let me explain what they are taking credit for. You may have heard of this thing that they're calling the air bridge, where it's really just an airplane that they're bringing from China on a regular basis, bringing goods to the United States, PPE, which sounds terrific, except for one thing. When they land at O'Hare Airport, those goods don't come to the state or to the cities. They go to distributors. Some of it goes to the White House and the federal government, and they keep it. But much of it goes to the distributors, the profit-making private businesses, distributors, who are getting the government to deliver to them their goods from China because they can't get them out of China. And then they get to decide where those goods go. So what they're taking credit for, the White House, is that the distributors have customers in Illinois that they're sending goods to because those customers ordered those items of PPE. So that's a far cry from delivering to the states so that we can distribute to, for example, a nursing home that has an outbreak. That's not what's happening by them. What they're doing is delivering to for-profit businesses that are selling for-profit to their prior customers who have ordered things from them.
These are from Univision. First question is about testing again. Do we already, how much testing do we need to say, okay, it's time to reopen the economy?
Look, there's not an exact number, but I would tell you this, that you need a lot more testing than we have today. And the reason I say it that way, I'm saying not an exact number because you can debate this question. I would argue that as we start to think about it, and remember, you need a lot of other preconditions, even according to the White House model of how to move into phase one of, what they're calling reopening. You have to get past the peak. You have to have 14 days of numbers going down, right? All those conditions. But on the testing front, I would ask you this question. What would make you feel comfortable going back into your place of work? How much testing, other people work with you, near you. What would you need to feel comfortable as you go to work every day, knowing that everybody in your workplace goes home and they go to the grocery store and they go to, wherever it is they go, visit their grandmother and so on, and then they come back to work the next day. And so I would suggest to you that, no, we don't need to test everybody every day in every workplace, but it's a lot more than just one test for each person. Because you would need to test, I'll give you an example of, at a nursing home, you would want to test the people who work there every day. And you would want to use one of those rapid tests, right, from Abbott or from one of the other providers. But in other places, maybe there's a less frequent. But if you think about that, we have 6+ million people who were working in Illinois before the coronavirus came along. For those 6 million people, some of them work in places where they really need to feel comfortable that others don't have it. So I would just suggest to you that where we are today, which is bouncing around in the thousands of tests, and that's where most states are really on it. We're about average, frankly, in Illinois. Not good enough from my perspective, about average in the United States for testing, per capita. We need a lot more testing across the country before I think everybody's going to feel comfortable, including the business owners and managers and people who work there, not to mention the customers.
This one from Univision for Dr. Ezike. Today we were supposed to get results of the hydroxychloroquine study, which I probably did not say that correctly. And we also hear that the University of Chicago has been conducting that test on the remdesivir, thank you, the drug listed to treat Ebola. Can you provide any update on either of those treatment options?
Yeah, we can give a full report on that. I know that they were supposed to have some results. Unfortunately, have not been able to read it and synthesize that information, so I can give you that at a later date. But I know we've been
this week to have something on that?
Sure, I can give you what's out there. I'm not conducting the trials myself. I know that many of our patients here in Illinois have used remdesivir. Again, I'm not involved in all the individual cases. I was in the beginning. Obviously, there are too many cases for me to be on site at the hospital talking to the doctors at this point, but I know we used remdesivir in many of our cases here, and so I'll be excited to look at that study, and I'm hoping that there's something promising. I mean, again, we all are looking for a treatment.
Thank you. Governor, from Sean Lewis at WGN. We've received many calls and emails from viewers concerned about their unemployment claims.
Yeah.
Haven't been processed, they can't get through, they are also, they want an update on where it all stands.
Yeah.
Some are concerned about bills getting unpaid, so what's the latest on the backlog?
Well, hundreds of thousands more claims have been processed since the last time that we gave you an update, and our plan is a little later this week to give everybody a full accounting of where we are. But we've got the pace of processing up significantly from where it was. Again, easier for people to get processed online than they can on the phone. But again, we've increased the number of people who are answering phones, the number of phone lines, and brought in outside help to do that. But we'll give you an update on that in just a couple days.
And from their affiliate in Champaign, dozens of grocery store workers have died from coronavirus despite temperature checks, capacity restrictions. So far, supermarkets have resisted banning customers from coming inside. What is your advice?
Well, I'm not the doctor who can provide the advice exactly, but I will tell you that it is of grave concern to me when people are gathering in close proximity anywhere, and that is happening most obviously anyway at grocery stores. And so we have a number of very good actors, honestly, out there who are grocery stores who are doing the right things. They're putting markers on the floors about staying 6 feet apart. They're asking people to wear masks when they come in, even maybe requiring it. And there are also actors out there who are not doing that. And that is what has led me to think hard about whether we should require people to wear masks when they go to public places like that. Because if you're not wearing a mask and you're not keeping socially distant, I mean, those two things together lead to people getting sick.
You've been thinking about that for a while. When are you going to decide?
Well, we're trying to put it together with the other things that we want to change about our stay-at-home order. But we also want to make sure that it's understood properly, that this shouldn't stop somebody from taking a walk in, their local park if it's open. That's not the idea. We don't want to stop people from going outside and enjoying the outdoors without a mask if they're not going to be in a public place with others. But when you're in a public place with others, or you think you are going to be, you should carry a mask, wear a mask with you, on you.
From Amy Jacobson at WIND, in Missouri, for instance, the state is slowly opening May 4th with different phases for different counties. Mm-hmm. Might that be the case here? The governor there is saying, okay, the mayors of St. Louis and Kansas City, they're going to extend their stay-at-home order. Is that something you and Mayor Lightfoot might consider county by county rather than an entire state order?
Sure. Well, Mayor Lightfoot doesn't have anything to do with the other counties or other cities, but I would say that as we make decisions about changing the stay-at-home order, or how we can, even after the peak, how we might phase in, people getting back to work, or people, reopening things, I absolutely think that we need to look at, where the capacity exists. For example, if the hospital capacity in a certain area is quite large and very available, even with coronavirus in existence, then that might be a place where you could do more, right, than some other place. What's most important, though, is keeping people safe and healthy. And so we're trying to think about, there's a lot of distance, as you can imagine, between people's homes in rural areas of Illinois. And so, the idea of people going outside and wearing a mask, on a property of theirs that might be 100 acres or 10 acres, is much different than the prospect of somebody, on the north side or the west side of Chicago, going outside and walking on the sidewalk with hundreds of other people. So the county by county idea is something you are considering? Yeah, or region by region, or just done, I think the important thing is that we want to keep people safe and also give them the ability to do as much as possible without spreading the virus. And so those are the complications. None of this is done on a whim. All of this is done listening to the people who understand the virus and know how it gets transmitted. And again, even they're learning. As you know, this is so new that some of the guidance that they've given to us who are, less informed, right? The experts giving advice to us have been learning along the way and giving more and more advice. You've seen CDC, for example, evolve the way they advise us. And so we're trying to follow that advice and look at, how best to give people the most freedom while also making sure people are healthy. And with 10 days left in that order, might we hear this week on whether it will be lifted, changed, altered, whatever your plan is? Again, a lot of this has to do with looking at every aspect of the order and seeing all the things that we might change. We're looking at it, working on it every day. I promise you that I will be out here, and tell you as soon as I can. Thank you. Those were the questions I received. Thank you.
Okay, we're going to go to Hannah and then John O'Connor, who both have similar questions, but I'm going to ask them both for the sake of transparency. The number of test results reported today is a little over 5,000. When will we see that number go up permanently as a result of all the testing capacity increases you announced on Thursday? Have all of the Abbott rapid test machines been delivered to health centers, prisons, and DHS sites, and are they up and running? What are reports that Abbott test results have false negatives?
Let me start. Let's see. I think there were 3 questions in there.
Yes, we did a lot of testing, but okay. Testing capacity. Testing capacity.
So again, let's just use the words specimens and testing results. As you know, you need those other items that I talked about earlier in order to actually get a test result. You need the machine and all the items that it takes to get the specimen into the machine and, of course, to take the specimen. So my optimism about testing has been that we've been able to obtain substantial, or quantities anyway. I wouldn't call them an abundance, but we've been able to obtain more quantities of each of those items, and we have those. And then you've got to distribute those to everybody who needs them and make sure that they're running tests. So all of that is a process that really has never before been run by the state of Illinois. That's usually run by commercial labs or run by individual hospitals. But now we're having to get them all up and running and reporting so that we can collect all the data and make sure that we're getting as many tests done as possible. So that is my optimism about it. When you ask, when will we start to see substantial changes? My staff knows that, that I've been pushing to make sure that all of these sites are doing as much testing as possible and that we get those tests run. So my hope is, again, I don't want to promise any time frame, but my hope is in the very near future, you will start to see thousands more than you're seeing now. But you will see that if you do it a trend line, and I do watch the trend line, every day it's going to bounce around, but the trend line has been up.
Jerry Nowicki at Capital News, Illinois. How many prisoners have been released from state prisons on medical furlough in response to the pandemic? Is that enough to address the spread in prisons? And how often does DOC make decisions to release prisoners?
I'll be happy to get you more accurate data than I can provide here at the podium for that. But I'll just say, that certainly I'm aware the last time I looked that there were 1,300 less prisoners than at the beginning of March. And, that has to do some of it with people who are near the end of their sentences. And, in the last little bit of a long sentence, the DOC directors decided to allow them to be freed.
Charlie Meyerson at ChicagoPublicSquare.com. A new ACLU report ranks Illinois the third in the nation for racial disparities in arrests for marijuana possession. It says black people are still more likely to be arrested for marijuana possession than white people in every state. What can the state do to address that disparity? I guess we've taken care of that one.
Yeah, well, thank you. Yeah, you don't need to. We addressed that when we legalized cannabis, adult use cannabis across the state.
Okay, this is Jim Haggerty at Rock River Times. Should people who believe they have COVID-19 and recovered be actively seeking to be tested for the coronavirus antibody, or should they wait for more widespread testing to become available?
It is hard. Even if you wanted to seek it out, it is hard to find them because, first of all, not all the tests are very accurate. And second of all, it's not widely available. So I would say you should wait to be tested. If you know someplace that is providing an accurate test, you should certainly try to go get it. But even on the White House call today with Vice President Pence, the discussion was had about serology and these antibody tests, and even they admitted that much of it is not yet proven.
Shia from Politico asked about considering possibly extending the stay-at-home order and using a regional approach, which you've already addressed. So I'm going to move on to the next question. This is Cassie Burke. We're starting to see school-specific budget projections from other states about the impact of COVID-19. Is there an estimate yet for what districts could be planning for next school year in terms of funding?
No.
Kelly Bauer at Block Club. Since the federal Paycheck Protection Program has run out of cash, what, if anything, will the state do to support struggling Chicago businesses?
Well, we worked hard, by the way, to make sure that our federal representatives were going to re-up the PPP program because we think that's a good program and should get re-upped. We also think that there needs to be other aspects of the bill that gets passed and hopefully signed by the president. So very much in favor of that. And then, as you know, we stood up a program with what money we had available at the Department of Commerce and Economic Opportunity to provide grants, not loans, to small businesses in Illinois. We need more for that program, and unfortunately, to get substantially more, we would have to do that with the legislature's consent, and the legislature hasn't yet met.
Oh, Kelly had a follow-up as well. What do you make of the big chains getting more money out of the program instead of small businesses?
Yeah. Well, I've been a big advocate of small businesses. Small businesses are the folks that create the most jobs. These are folks who risk their lives and, or livelihoods rather, and their savings to go out and start a business and build it. And I mean, I really want small businesses to survive. It's extraordinarily difficult in this moment, absolutely. And so I was hoping that the federal government would lean that program towards small businesses. But I know that they're also, I'm not forgiving it, but I mean, I know they also look at, medium-sized, large-sized employers and say, well, gee, we want to save all those jobs too. And so I think it's a balancing act. But again, I'm a huge advocate of people who, go out there and start a business and build it. And I would hope that they would get the most consideration.
Dave Dahl at WTAX, what assurance can you give Illinoisans that their children's education is legitimate and credible, especially seniors expecting to go to college and or a career now?
I'm not sure the what's behind that question. You mean that e-learning might not be the full extent of what you would want for the last part of your education? I mean, the one advantage, in all this, or the one blessing, I guess, is that this happened at a time of year when, it isn't taking out all the education for the entire school year. But it is very important that teachers and school districts have implemented either e-learning or some other form of distance learning, and everybody's doing the best that they can, and that's all I can say. I mean, a pandemic has interrupted people's education, and teachers are managing it, and frankly, quite well given all the circumstances.
Molly Parker at the Southern Illinoisan, is the state tracking outbreaks at county jails and detention centers? Why is IDPH telling local health departments it is not necessary to report an outbreak at a jail?
We don't track jails, but I mean, I'm happy to turn it over to the doctor if she wants to talk about prisons that are under the control of the state. Anything to add?
Of course, IDPH is, working in lockstep with our state agencies. I talk to Director Jeffries on a regular basis a lot recently, so we're keeping a close eye on everything that's happening in all of the facilities and working closely with him and his team to try to keep those situations at bay. Please understand that the correctional facilities are very similar to our long-term care facilities in terms of all of them being congregate settings where large numbers of people, live, play, eat in the same space, and so being able to maintain distancing becomes challenging, and once it's introduced into a facility, it is easy for it to spread. So a lot of the same strategies that we're employing for long-term care facilities are those that we're using for correctional facilities. But yes, we're working closely with them.
Doctor, this next question's for you. There seems to be growing evidence that skin rashes that present like measles and chicken pox and frostbite are possible symptoms of COVID. Is this something you're seeing? That's from Karen Jordan at ABC.
Yeah, so I try to follow as much as I can what it looks like on the ground. So at the beginning of this, we were saying it was cough, fever, shortness of breath. We've now seen a lot of anosmia, difficulty smelling, loss of smell. We've had some redness of the eye. So there are a lot of different presentations of this virus. The longer we know the virus, the more we see of it. Again, remembering that we've only known this virus really for the last 4 months. And so as we get more data, as we see more people who come positive and we see their symptomatology, we develop new symptoms that we see, have become more prevalent. So we're continuing to amass that data. And so I'm not surprised if new symptoms come along that will be shown to be part of the virus. Again, these viruses can show themselves different in different people, just like influenza can cause diarrhea in someone and cough in another. So yes, I wouldn't be surprised if rash could be something that's seen in people, but maybe it's not the majority of people and maybe it's a much smaller minority.
Okay, we'll do 2 quick ones. Jim Leach at WMAY, have you given any thought to where you want to see spending cuts in the FY21 budget to make up for the revenue shortfall?
We're working on the budget for sure, and obviously in consultation with legislators, budgeteers, as they are sometimes referred to as, representatives who serve on the budget committees of the House and the Senate, as well as the leaders. So we'll be coming out with, whenever it is that we can organize for the state legislature to meet, we'll be coming out with some proposals.
Greg Bishop at the Center Square. For clarity, what specific metric and target or goal are you using to determine when the state's economy can reopen?
I think there were aspects of the plan that Dr. Fauci and Dr. Birx and the White House put out that are worth looking at. For example, the discussion about when does phase one, as they refer to it, begin, and that is, past the peak, 14 days of numbers going down. So, I think that's probably a pretty good metric, and it gives you an idea if you think, about if we haven't quite hit the peak yet, you won't really know, by the way, that you've hit the peak until you start to go down, and so that I think is the marker that everybody should be looking for. That, and one other thing you asked about, Marianne asked about remdesivir and hydroxychloroquine, and those are just 2 of 70 treatments and therapies that are that are being researched right now and have trials going on. And I'm hopeful and prayerful that one of those, or several maybe, will turn out to be efficacious. So,
all right, thank you.
Thank you.